In our last video, we talked about who a medical virtual assistant is and how they support healthcare providers remotely by assisting with administrative and clinical documentation tasks, right? Now, because this job involves sensitive patient information, it is important to know the do's and don'ts to follow. And in this video, we are going to be talking about it. So let's delve right in. Hi everyone, welcome back. My name is Precious Uzochi Chinedu and I'm a registered nurse who is currently transitioning into the medical virtual assistant job. So today we are going to be talking about the do's and the don'ts of a medical virtual assistant. Number one, you must maintain patient confidentiality. A medical virtual assistant is taught to always maintain confidentiality by protecting patient information at all times, right? You must use secure systems, laptops, PCs and whatnot. You must log out of your systems when not in use. Yes, you must use secure password. You must never share patient data with anyone or outside approved channels. These are really important, and if you break any of these, you are breaking HIPAA rules, and we don't want that, right? And so number two, documentations must be accurate. So you are recording patient notes into the EHR system securely and accurately, of course, and you're also checking for spellings for medications and dates and ensuring that they are spelled correctly, right? You're double checking dates, double checking diagnosis, double checking medications, right? Just to be on the safe side, okay? And you're ensuring that charts are updated correctly at all times. If a provider updates a patient's chart, just ensure that you are documenting that as well, just to stay updated. So you're not going to be giving a medication that the provider has already removed from the patient's chart and you're still giving it to the patient, right? So these are very important informations, okay? And you don't want to make mistakes about it. And so number three, you're going to be communicating professionally, okay, at all times. Speak politely to patients and of course the medical team as well, okay? And you're supposed to be using clear and professional languages in emails and in calls at all times. Please, you have to be polite, you have to be professional at all times, okay? And you're also going to maintain empathy while dealing with patient concerns. Of course, if you're a nurse, this should be easy for you. You should always be empathetic at all times while dealing with patient concerns, while handling their situations, while answering their calls, their messages, replying to their messages and all whatnot, okay? So yeah, that's that. Number four is that you must stay organized. You have to manage appointments, schedules and follow-ups properly. You don't let schedules to clash, okay? No matter what, you're supposed to track patients' records and reminders at all times. And then you must prioritize urgent tasks. So you're going to go from urgent to non-urgent. Okay, prioritize the emergency cases and tasks first, things that could cause problems, okay? So that's that for that. And number five is that you follow physicians' instructions at all times. Doctors' instructions, providers' instructions, you must follow it to the letter, okay? You only perform assigned tasks. Don't do what you're not asked to do. You clarify instructions if they're unclear. So if there is an instruction given to you and you don't get it, do not do guesswork. Just ask questions and clarify that before performing such tasks so that you don't make mistakes. We are handling patients here, we're handling human beings, okay, and their lives are very vital. So we don't want to make mistakes that could cause somebody's life, okay? Number six, right? I hope I'm right. Number six is that you don't give any medical advices, no matter what, okay? As a medical virtual assistant, I know that most times our experiences or the things we've had so far might prompt us to want to give medical advices, but no, don't do that. You're not allowed to give medical advices, especially when you're not licensed to practice in that country, okay? So don't be tempted, don't do that. If there's a question you need to answer from a patient, always flag it to the provider to give you accurate information regarding that, and never diagnose or recommend treatment for the patient. Don't do that, okay? We don't want to get into trouble now, right? Number seven is that you don't share credentials, okay? You don't share your login details. You don't give someone else access to your systems, okay? No matter what, it's not allowed, okay? Always protect your your patient's information at all times. In number 8 right now, right? Again, don't guess informations. Don't. If you're unsure about patient details or a particular medications or a particular dosage of how to administer the medications to the patient, make sure you're asking your provider to explain better for you. Okay, don't guess. Do not assume, please. This is very important. Do not assume anything. Just go ahead and ask questions if you're very unsure about anything. Number 9, don't walk outside of your scope. Now, already you have a defined job role. Okay, your job is to handle scheduling, billing assistance, transcription when necessary, and even scribing when necessary, right? Patient communication, replying to emails and messages and calls and all of that. This is your scope of work. Okay, don't go beyond that, please. That's it. And number 10, please do not be unprofessional online. Avoid discussing your patients, your clinics in social media spaces. No matter how much you're being tempted to, don't discuss that online, please. And please, I'm begging you right now, don't do that. Okay, so yeah, the summary of everything I've said so far is: number 1, confidentiality; number 2, accuracy, so that's accurate documentation and all of that, right? Number 3, professionalism. You have to be professional at all times. These are what makes you a very good virtual assistant. Okay, so yeah, these are the do's and don'ts of a medical virtual assistant. If you watched up until this moment, I want to say thank you very much. Please subscribe, please like, please share, just so I know that you love my content. Okay, thank you once again, and see you in my next one. Bye.